This skill will begin with the opening. Knock and identify your patient. Introduce yourself by name and title. Describe what you will be doing. Obtain permission. Close the curtain and wash your hands. When you return, explain to the patient what you will be doing. Obtain a privacy blanket from the supply cabinet and carefully unfold it over the patient's sheet. Do not snap or shake the blanket. Hold the blanket in place while you are pulling the sheet down under the blanket toward the foot of the bed, ensuring the blanket is covering the patient for warmth and privacy. Place a barrier on the overbed table to provide a clean area to place your clean supplies onto. Gather 3 clean pillows from the supply area and place them onto the barrier, being careful not to allow the pillows to touch your clothing. Verify which side the patient should be turned onto, as indicated in the care plan, and position yourself on the side of the bed opposite the side the patient will be turning toward. Ask the patient to scoot his body toward you so he is lying on his back near the edge of the bed. Place his farthest arm up onto the pillow next to his head, and his closest arm should be placed across his chest. Carefully bend his closest knee so that his foot is flat on the bed, and adjust the blanket so the patient does not roll onto it when he is turned. Place one hand on his hip and one on his shoulder, and gently roll the patient onto his side. The patient should now be lying on his side in the center of the bed. Pick up the first pillow and uncover the patient's back. Prop the pillow lengthwise against his back, and using both hands at the top edge of the pillow, push the top edge of the pillow down and under the patient's back. The second pillow edge is rolled upward toward the patient and pushed downward and under the patient's back directly on top of the first edge. The 2 ends of the pillow should be tucked under the patient, leaving a roll along the back. Replace the blanket over the patient's back. Move to the end of the bed on the side facing the patient. Uncover the patient's legs and pick up the second pillow. Lift the top leg and place the pillow lengthwise between the patient's legs, making sure the leg maintains a natural curve and the pillow is between both the knees and the ankles. Replace the blanket and ensure the patient is comfortable. Bring the final pillow toward the head of the bed. Lift the patient's top arm and place the pillow under the patient's arm, supporting the entire arm in a natural position. Make sure the pillow does not cover the patient's face. Adjust the pillow under the patient's head so that the pillow is under the head and not the shoulder. Make sure the patient is not lying on his arm and neither arm is hanging off the bed. Replace the top sheet over the patient and remove the privacy blanket, placing the blanket in the dirty linen hamper. Dispose of the barrier into a trash receptacle. Place the call light into the patient's hand and ask if there is anything else the patient needs. Ensure the patient is comfortable. Open the privacy curtain and wash your hands. Review all steps of the skill and make any necessary corrections. Tell the evaluator your skill is done. Need scrubs for your new career? Visit foryouruniforms.com and enter the code CNA Video for a special discount. Need additional resources? For Your CNA has what you need. With practice tests, an online workbook, instructional videos, practice kits and supplies, and our very own skills book with step-by-step instructions, you will feel confident when you take the CNA exam. Visit foryourcna.com today. Continuing education for CNAs are called in-services. In-services are now offered online at foryourcna.com.